Heart failure is a chronic, progressive disease that continues to be challenging for patients, their caregivers, and the healthcare system. A diagnosis of heart failure carries intrinsic clinical risk to the patient. While baseline risk can be reduced with treatment and management, some residual risk remains. Over time, patients can enter a period of worsening risk, in which they experience worsening heart failure events, characterized by escalating signs and symptoms of heart failure that result in treatment in an outpatient or inpatient setting. Some patients who experience these events can progress to a stage of advanced risk, in which heart failure can be fatal without mechanical circulatory support or heart transplantation. In one study, over half of patients who experienced a worsening heart failure event were re-hospitalized within 30 days. And more than 1 in 5 patients who experienced a worsening heart failure event died within 2 years. While all patients with heart failure with reduced ejection fraction, or HFrEF, may be at risk of progressing, a greater proportion of those who experienced worsening heart failure events had a higher New York Heart Association class and a lower ejection fraction. Given the increased risk associated with worsening heart failure events, it is vital to recognize patients experiencing them. Meet Mary, a 67-year-old grandmother of 4, recently diagnosed with HFrEF following complaints of fatigue, dyspnea, and ankle swelling. Mary's symptoms worsened until she received therapy, which helped stabilize her after this worsening heart failure event. 3 months after the event, Mary's NT-proBNP level may indicate she is at increased risk for another, as observed in a cohort analysis of patients with chronic heart failure. The PROTECT study showed that the serum levels of NT-proBNP in patients with chronic heart failure were directly related to their risk of experiencing a cardiovascular, or CV, event. While patients like Mary often recover from an event and experience a period of clinical stability, signs and symptoms of heart failure can re-emerge, increasing the risk of poor outcomes, namely CV death and re-hospitalization. Now meet Oscar, a 70-year-old veteran admitted to the hospital for atrial fibrillation. Oscar has a history of chronic HFrEF that includes 2 previous hospitalizations. Oscar's history puts him at high risk of re-hospitalization and death. It is important to recognize patients in this stage of worsening risk before their heart failure advances. Worsening heart failure events should serve as a catalyst for escalating the monitoring and management of patients like Mary and Oscar, who are at increased risk of hospitalization and death.